Hello, good morning, good afternoon, good night, and mid morning to all our listeners and our audience with us today on this webinar. My name is Shirin Lakhani. I'm from Sydney, Australia. I am a junior secretary of WICCI NRI Council. I am an author, I'm a cancer fighter, a mother, and a proud member of the Indian diaspora here in Australia and someone living in Sydney and actively engaging in organizations like WICCI NRI Council, I have witnessed how culture barriers can prevent women, especially migrants, from accessing timely care or speaking openly about their health. I share my story to break those barriers, to remind women that vulnerability is strength, that early detection saves life, and that healing is possible. Today, our theme Global Voices for Women Health Uniting Against Breast Cancer resonates deeply with me. It's just not about awareness, it's about connection. It's about ensuring that every woman, regardless of where she lives or what language she speaks, feels seen or heard and be supported. I believe our voices, when united, can shift narratives and save lives. I'm proud to be part of this global moment, one that celebrates courage, fosters empathy, and champions women's health across borders. My journey through cancer was one of the most challenging chapters of my life, but also the most transformative. When I was first diagnosed, I felt uncertainty and isolation, but through resilience, community support, and sheer determination, I rebuilt my life and emerged stronger. Today, I stand not just as a fighter, survivor, but as a voice for countless women who face similar battles in silence. Breast cancer knows no borders. It affects women of every nation, culture, and background, yet in the face of a shared challenge. But uniting across continents, we can break the silence, dismantle stigma, and ensure that every woman, regardless of geography or circumstance, has access to life saving information, early detection, and quality care. Together, we are not just raising awareness, we are building a global sisterhood committed to prevention, support, and hope. Let this be the moment we speak louder, act bolder, stand stronger because every voice matters in the fight against breast cancer. Let's continue to rise together. Let me first introduce you to one and only the president of our council, Dr. Anar Mehta. Though Dr. Anar Mehta is virtually at the moment not with us, her presence is deeply missed on this webinar today. Let me tell you a few things about Dr. Anar Mehta. She has founded WICCI NRI Council on December 2020. It's exactly 5 years in a month's time. So that's a big achievement for WICCI NRI Council. And I applaud all the members who are here and who have made this happen. So congratulations to all the members of WICCI NRI Council been with us for the last 5 years and to make these things happen. The national president, Anar Mehta, has been a social entrepreneur. She is basically from Ahmedabad, Gujarat, India. She is a UN awardee, a founder of Srishti Bharat NGO. She is widely recognized for her work in women empowerment, social innovation, and global advocacy. Her vision, she champions gender equality, economic inclusion, and cross border collaboration among Indian women living abroad. Her mission is to connect and uplift non residential Indian NRI women through entrepreneurship, leadership, development, and community engagement. The Council spans multiple countries, creating a platform for Indian women to share resources, build network, and influence policy. Let the digital WICCI NRI Council bringing together women leaders from around the world. Anar Mehta's leadership continues to inspire a global sisterhood of Indian women committed to progress and empowerment. Welcome, Anarji. Though missing you so much, you're still with us today on this webinar. So it's a warm welcome to Anarji. Let's continue and meet the very precious lady, a role model, I would say, into my life. Let's present and call upon Achla ji, our Vice President for WICCI NRI Council. She is an expert sustainability social impact leader and she helps lead digital initiatives to empower non-resident Indian women through entrepreneurship and advocacy. Her expertise are sustainability, climate action, environmental education. She is the chairperson of Sustainable Future Foundation, promoting eco-consciousness living and global compliance standard. Without any further delay, let me call upon Achalaji to the stage. Achalaji, welcome, and the stage is all yours.
Namaste. Am I audible, Shrinji?
Yes, you are.
Thank you so much, Shrinji, for opening today's event so smoothly and with such a positive energy. Today's session reflects that spirit of connection and care. As an NRI woman, it is especially important for us to come together to discuss women's health and well-being while raising awareness, sharing knowledge, and supporting each other across border and obviously without the barriers of time zones. This platform gives the opportunity to empower ourselves and our communities with the information needed to lead healthier and stronger life. Going towards the event, it gives me great pleasure extend warm welcome to our esteemed speaker. First of all, warm welcome to Dr. Mallik. He's a senior oncologist who will be sharing his valuable insight on breast cancer risk, sign, preventive measure, and the importance of emotional resilience. Warm welcome, Dr. Mallik. Heartful welcome to Ritika ji, a courageous cancer survivor whose journey embodies hope, strength, and determination. Warm welcome, Ritika ji. Special welcome to our own sister Padmaja ji, whose empowering dialogue helped break stigma and build a strong circle of awareness and support for women everywhere. We're also delighted to have with us Shaifali ji, our General Secretary of WICCI NRI Council, whose support and dedication strengthen every initiative we take. And our special regards to Dr. Anar Mehta, President, whose vision and unwavering commitment to women's empowerment guide every efforts of the WICCI NRI Council, even though she could not join us today. Finally, I have the pleasure of inviting our host Shirin Lakhani to take the stage. Shirin ji is a cancer fighter, devoted mother, and inspiring advocate for women's empowerment. As a joint secretary of WICCI NRI Council and author of She Grows Stronger, she continues to guide women worldwide with the courage and compassion. We are truly honored to have you here and to lead the session. Shirin ji, the stage is yours.
Thank you so much, Achla ji, for the warm welcome and welcome all our speakers for tonight. Let's keep the ball rolling. Let me start by calling our guest keynote speaker for tonight, Dr. Mallik Singaraju. Let me give you a little bit of a brief about Dr. Mallik Singaraju. We are delighted to welcome our keynote speaker, Dr. Mallik, tonight. He's an oncologist at Continental Hospital, Hyderabad. With over 18 years of experience, Dr. Mallik is highly respected radiation oncologist known for his expertise and advanced cancer treatment techniques and compassionate patient care. He is the founder of Singaraju Cancer Foundation, established with the vision to create awareness and promote early detection of breast, cervical, and oral cancers. Through this foundation, he has been actively involved in cancer awareness drives and screening camps across community. Dr. Mallik has been recognized in the Guinness Book of World Records for his participation in the latest breast cancer screening camp. His dedicated service has earned him several accolades, including the Vidya Ratna Award, Star Gold Award, and the Business Mint Award for Excellence in Oncology. He was also featured in Humans of Hyderabad for his remarkable contribution to society. We're truly honored to have Dr. Malik with us today and to share his valuable insights and inspire us all through his journey and work in the cancer care. Dr. Today's stage is all yours. We welcome you warmly. The stage is all yours.
For the invite. And first of all, I congratulate Vicky NRI for taking this initiative. important initiative need of the hour.
Dr.
Yeah, can we
Madhav, we
have the
cannot hear you.
presentation? Yeah.
Yes, we can hear you now.
Okay. Thank you. Yeah, today's topic is about the breast cancer awareness. So today mainly we are concerned about early detection and prevention of breast cancer. See, February 4th is observed as World Cancer Day by WHO to create awareness regarding cancer symptoms, its symptoms and impact on the world. Usually we are aware of two or three ribbons. One is pink ribbon for breast cancer and purple ribbon for cervical cancer. But when you look at the image, you are seeing so many colored ribbons here. Even many of us not aware of so many colored ribbons. So what WHO has done is it has grouped different types of cancers together and allotted a ribbon for each type of cancer group to create awareness about that particular cancer group. So when we are talking about the global cancer incidence, when you look at the picture, almost 50% of cancer cases are from developing countries. So once upon a time, the scenario was other way around. Most of the cancer cases were coming from Western world or developed nations. Now, most of the cancer cases, we are seeing almost 50 to 60% of cancer cases are coming from developing nations. So when we are talking about our own Indian statistics, because I didn't want to take about global statistics because more or less we are talking from our subcontinent or developing nation perspective. So when we are seeing here almost every year, nearly 2 lakhs new cancer cases are being diagnosed. And what is more alarming is more and more young patients are being diagnosed with cancer. When we go back 2 decades back, when I was doing my post graduation, we used to get more of elderly people more than 55, 60 years, they used to come with cervical cancer, breast cancer. But now we are seeing more and more young patients coming with cancer. And every 10 years, every decade, the number is doubling constantly. So I just want to give a brief introduction, or I can say, I just want to uh, highlight what is cancer, because most of the people still are not aware what is cancer. Some people think cancer is something which comes from outside, it is attacking from somewhere. Some people think it's just germs. A lot of misconceptions are there among people. So basically, it's just an imbalance which is happening in the body. So every day, thousands of new cells are being produced in our body. At the same time, most of the unwanted and excess cells are constantly being removed by our immunity. So whenever there is an imbalance, like whenever there is excess growth of cells or there is lower immunity, that results in cancer. Cancer is nothing but overgrowth of cells in a particular tissue or particular organ. So basically, it's a fine tune of balance, and whenever there is imbalance, that results in cancer. So let us briefly discuss about the risk factors. Everyone knows about tobacco. Almost 90% of cancer cases are caused by tobacco. And next, it is closely followed by diet, the junk food we eat, the packed foods, the preservatives. Every day we keep seeing different kinds of preservatives causing different kinds of cancers. So that is a very important contributory factor for cancer. And the exposure, chemical exposure. So whatever we are constantly being exposed with food, water, air, chemicals by traffic, contamination, industries. Next, alcohol. Alcohol though it's not a major contributor, still it can cause different cancers like liver cancer, colorectal cancers. And next, hereditary. Once upon a time, we used to use only three words: smoking, drinking, hereditary. Beyond that, we didn't know. But now, if you see, the priority of hereditary cancers is just little lower than all the other risk factors. Apart from that, there is sedentary lifestyle that also contributes to cancer, and different infections that are like human papilloma virus, hepatitis B virus, Epstein-Barr virus, different infections causing different types of cancers. The last but not least is the emotions. All the negative emotions definitely lead to cancer. That basically all the negative emotions like resentment, anger, hatred, jealousy, all these things, they affect. There's a lot of literature currently available. Their immunity ultimately resulting in cancer. This is my favorite slide. Each and every emotion, just beware whenever you're going through all these emotions, be aware each and every emotion is affecting each part of our body. So when we're talking about early detection, it has two arms. One is creating awareness about cancer signs and symptoms, and second thing is screening. Screening is nothing but detecting cancer before it is evident, or we can call it detecting cancer in a zero stage. So we all know that when cancer is detected early, it is totally curable. See, when you look at its image, see what I want to tell you is cancer doesn't happen overnight. It will take significant time. By the time the changes start happening in the body, from the time we detect the disease, it takes significant time. Most of the time, because of lack of awareness, because of ignorance, many people ignore the symptoms. So here we see there's always a particular critical point where the disease can be detected just before the appearance of symptoms. That's where we are targeting. That's where we are targeting to catch the disease at the earliest. So coming back once again to scenario of developing nations, there's a main stigma to go for screening. One is fear. People are afraid to go to doctor, even though they find some symptoms. They're afraid to go to doctor. They don't want to listen to anything. They're afraid what doctor will tell. Okay, what test is going to run, how much is going to cost. Because even now, females prioritize their family before themselves. They keep everything else in front of them, and they keep themselves towards the end. So that is one main factor. Second is denial. Usually people are in the mode of denial. They think, no, I can't get cancer. Because when we keep interacting with patients, we'll ask them, why did you come so late? Because we see most of the cases, especially in India, they are detected in a very advanced stage. So when we ask them, why did you come so late? They give different reasons, and many times there's a religious background also in that. They say, no, I'm a very religious person, I'm a pious person, why will I get a cancer? So that is the level of ignorance prevalent in the society. So, see, luckily, most of the common cancers like breast cancer, cervical cancer, head and neck, colorectal, prostate, all these cancers can be screened and detected very early. So I think today is the last day of Breast Cancer Awareness Month, and every day should be an awareness day. And this is the theme of WHO for 2025. Every story is unique, every journey matters. So most of us are aware, one in every 8 women are at risk of developing breast cancer. Previously, cervical cancer was most common cancer in India, but now, in especially in urban areas, breast cancer is very common, and still cervical cancer, though it is number two cancer in women, it is very common in rural areas and low socioeconomic group areas. So, though I have mentioned general risk factors for cancer, when I am talking about breast cancer in particular, personal history of any precancerous lesion in breast or a breast in cancer in opposite breast, ovarian cancer, endometrium cancer, they all have high risk of developing breast cancers. Similarly, somebody is having a strong family history or genetically positive, BRCA positive cases, obesity. When I was talking about the diet, obesity again contributes to endometrial cancers, breast cancer, and ovarian cancer. Again, hormone replacement therapy and nulliparous women. So these have specific risk for developing breast cancers. So when we look at the symptoms, so whenever there is any change in size and shape of the breast, changes happening in the skin, or appearance of any hard lumps which are not coming down, or any changes happening in the nipple, like cracking in the nipple, discharge from the nipple, bleeding from the nipple, or any swellings in the axilla, all these things we should be aware that it could be warning sign of breast cancer. First of all, should not panic because most of the changes are physiological changes. See, when a woman goes through puberty, pregnancy, lactation, menopause, so many physiological changes keep happening in the breast. Sometimes there'll be some breast discharge from nipple as well. It could be just hormonal changes or some kind of infections. Every change need not be a cancer. So first, you should go to doctor and consult the doctor. So when we're talking about breast cancer screening, all the women above the age of 20 years should undergo every month monthly breast self-examination. There's so many videos in the YouTube how to do breast self-examination. So one particular day, like first Sunday, second Saturday, some whatever works every month on a one particular day, if you should keep, and keep doing breast self-examination. And all the women after 40 years, they should undergo mammography. So how frequently we should undergo this mammography? At least once in 2 years. If everything is normal, if there's no evidence of any lesions, no lumps, once in 2 years they can undergo mammography. But in case there are any suspicious lumps in the previous mammography or any pre-cancerous lesions or a strong family history or somebody is having ovarian cancer or opposite breast cancer or any kind of risk factors, they should undergo mammography every year. And these are the warning symptoms you should never ignore, because this particularly I kept this slide again because any changes happening in and around the breast or skin of the breast, any hard masses, any pain, sagging pain, normally during, as I said, during physiological changes are common during periods, before and after periods. These things are common, but any abnormal pain, dragging sensation, any swellings in the axilla, it should be reported to a doctor. So this was a scenario maybe a decade back. People used to ask us, "Sir, my mother is diagnosed with cancer. My grandmother is having cancer. Can I get cancer?" Well, we didn't have proper. We used to tell, "Yeah, you might get, you might not get." Like we didn't have proper answers, but now we have answers. We have genetic testing available with us nowadays. So, what does genetic testing do? So, when we conduct, there's so many different gene panels available. So, with the help of this genetic testing, we can identify almost so many, not only cancer, so many different type of health conditions can be detected early, and especially somebody is uh, first degree relatives like mother, sister, somebody is detected with cancer, or a strong family history in one side of the family, like mother's mother, mother's mother, mother's aunt, your cousins, like one side of family, there's many cancer cases, definitely they should undergo genetic testing. So what is the importance? Why we should go for genetic testing? So genetic testing will just help us to know the risk of developing that particular cancer or a group of cancers with the germline suggests. It is not that if the risk is high, you will get cancer, but it shows the risk of developing cancer. It has little more relevance in different setups. If you look at Western world, they're little more aggressive. We all know famous actress Angelina Jolie. She was BRCA positive and she has a strong family history. So she underwent prophylactic mastectomy, bilateral mastectomy, and again she underwent reconstruction. So in Western world, most of the people they go for a prophylactic removal of ovaries, their risk of ovarian cancer, or removal of ovaries, removal of uterus, or removal of a part of colon. They're at high risk of developing colorectal cancers. But when it comes to our scenario, we are not so aggressive, but at least it will help us to go for a regular screening and also help us for preventive measures. So let us see how we can prevent cancer. First thing, trying to maintain an ideal weight, balanced diet, and a regular physical activity. So our plate should be as colorful as possible. Should include all green leafy vegetables, fruits, nuts, grains, everything, fiber especially. And when it comes to activity, so WHO has clear guidelines. It says should have at least 40 to 50 minutes of voluntary activity at least 5 days a week. But we do a reverse of it. It's very important. Physical activity is known to reduce the risk of many diseases, not only cancer, but many diseases. And adapting a very healthy lifestyle, smoking, drinking, limit as much as possible. As I was mentioning earlier, we have seen how each emotion affects each part of the body. So fostering positive mental attitude is very important. We can evolve our own way. And I've been seeing, I've been listening what people of WICCI NRI are doing, what they're doing. They're offering service. They're serving the society. Not only they're taking care of their own businesses, but they're also offering help to society and other needy people. This is very important to maintain immunity. You need to have a proper sleep. Sleep deprivation, again, it reduces the immunity and results in many diseases. And this is very important, not only about, though we're talking about breast cancer, in general, when we are starting in mid 30s, we should start for cervical cancer screening, followed by when we come enter 40s. See, every decade we are adding something new. So when coming to 40 years, again, we had cervical, breast, colorectal, prostate. And again, we are going to 50 years, again, we should add lung cancer as well. And nowadays it's very popular. See, human papilloma vaccine not only prevents cervical cancer, but it protects against 6 different types of cancers like oral cancer, throat cancer, anal cancers, genital cancers. So many different 6 different kinds of cancers. So definitely we are advocating to take the vaccine both in girls and in adults till the age of 45 years. So we have just mentioned earlier how we can prevent by developing healthy lifestyle, balanced diet, screening, vaccination, fostering positive emotions, physical activity, and genetic counseling. I would take a few moments to just share what we have been doing from our foundation side. We have been regularly involved in creating cancer awareness, especially in urban areas. And also, we have been conducting several events to create awareness. We have been doing the top one exit was on October 31st only. Uh, like we have been doing several events to create awareness about different cancers, not only breast cancer. We have done No Show November to create awareness about prostate cancer. Primarily, our focus was on breast and cervical cancers. So when it comes to rural areas of Telangana and in and around Hyderabad, I was focusing more on rural population where the access to healthcare is limited and low socioeconomic groups, even in the cities where they have limited access to the healthcare. We're providing free oral breast and cervical cancer screening. So we have screened almost around 3,000 individuals, and we have identified several Our aim is not to check cancer, but to identify precancerous lesions. So we have detected several precancerous lesions, and we have referred them to the higher centers. Yeah, we request all socially conscious individuals like you to join our journey to create cancer awareness and early detection of cancer. Thank you so much.
Thank you so much, Dr. Malik. This was so informative. I just can't say how knowledgeable this was and how much have we gained across by knowing all different types of cancers, what can be a cure, what medicines or what vaccinations can be taken for a cure. So it was really, really informative. Just on a small thing, as life says that, it's a very small circle. I belong to the same town, Hyderabad, Telangana, and I have been to Continental Hospital for my surgeries. So I can literally resonate with you. And being a part of Hyderabad, I'm glad that I see you here, and I would see if at all I'm coming to India. It'll be a pleasure meeting you face to face.
Sure, ma'am.
Sure. Let's keep the ball rolling. Let's take a round and now hear from someone who has gone through this journey of cancer and is a survivor. Let's meet Ritika ji from Singapore. Ritika ji is a two-time breast cancer warrior who has faced her journey with incredible courage and positivity. Today, she's here to share her experience and reminds us why awareness and early detection matters so deeply. Please join me in welcoming Ritika ji to the stage. Ritika ji, the stage is all yours.
Ritika ji, please
Ritika ji,
unmute yourself.
yeah,
Can you hear me now?
yes,
Yes,
we can hear
yes.
you now.
Yes.
Yeah.
Thank you so much, Shirin. And Dr. Malik, that was really a very informative session. I mean, I've attended lots of sessions, but this was really very informative, covering such a range of topics. Thank you so much. Thank you for inviting me for this forum, and thank you, Padmaja ji, for calling me on for this topic, which is so very close to my heart. Hello, everyone. My name is Ritika. I live in Singapore. I call Singapore home for the last 25 years or so. Before that, I was from Bombay. I work here professionally in the banking industry. I'm a risk manager. I have two grown-up children. I have a 21-year-old son who's finished his national service, which is the army, and he's now in university. And I have an 18-year-old daughter. Before I start to share my journey, I wanted to give a quick snapshot of the statistics in Singapore. I know Dr. Malik shared some global statistics and also Indian statistics. I can, give a slight count. It's about the same. So the study or the data that I have available in Singapore is as of 2022, and as there's a staggering 1 in 4 people who will develop cancer in their lifetime as of that study. And I'm sure most of us know someone or who know someone who's been through a cancer journey or who's going through one now. It's so common, the word cancer is so very common everywhere. So in Singapore, for women, breast cancer is the highest, most common cancer, and it affects 1 in 12 women in Singapore, 1 in 12. And I would say, if I were to look at a silver lining, I mean, when I got the cancer, I was like, someone told me, if you were to get a cancer, breast cancer is the best one to get. And the reason is that because it is such a common cancer, there's been a lot of, it's very well researched. There's a lot of medical, dollars thrown into it. So there's a lot of research. They have very good targeted and effective treatment that is available now. And medical technology has surely come a very long way, in the last few decades. And cancer is no longer, a cancer diagnosis is no longer a death sentence that it once was. So I lost my mother to ovarian cancer about little over 3 decades ago, but that time things were very different. I mean, I remember her going through chemo, and my journey has been very, very different. It's come a long, long way, the technology, etc. And thanks to awareness, such talks and various screenings as well as awareness, 57% of breast cancers in Singapore were diagnosed at stage 1 as of 2022, compared to 33% in 2017. So more and more are getting diagnosed at an early stage, at least here in Singapore. And that's a great news, because the earlier you detect, the better the survival rates. So we want to, like doctor said, we want to catch it at stage 0 even, right? So the earlier we detect, the better it is. So which is why we want to spread the word, and, awareness is key. So I, like you said in the intro, I am a two times, unfortunately, 2 times breast cancer survivor. So I'll dive a bit into my story now. So I was first diagnosed around Valentine's Day in Feb 2023. I discovered a lump in my breast, and for a few weeks it wasn't going away. And like doctor said, the change in the period cycle and so on, things change. So you have to observe it for a while. So it didn't go away for a few weeks, and I knew something is wrong. So I went to get it checked out, and yes, it was diagnosed as stage 2, because it had I had a lump also in my armpit, right, in the lymph node. So it was stage 2. And acceptance is really the hardest part, right? Because it comes to a why me kind of thing, right? I mean, I did everything right. I breastfed my kid. I eat well. I exercise. I do all the controllable things that doctor mentioned, right? I don't smoke. I hardly ever used to drink. So it's like I did everything right. So why did it happen, right? I mean, and it is such a common cancer that it's really, you can't pinpoint anything. It is the external environment or stresses that we undergo, right? So it's really, you can't blame anything or anyone for it. You just have to accept, and then take it in your stride. So I had a very good team of doctors, and I completely trusted them and the plan that they came out with. So I had to undergo 6 rounds of chemotherapy at that time. It was very, very harsh, the worst of symptoms that you could imagine, and I had them all. It was like a earthquake, which is inside my body all the time, and it like completely shakes you up. I had ulcers everywhere. I had blood. I cannot even mention, a very bad nausea, very bad diarrhea. I had very, very, very severe symptoms. But the good news is I persisted, and by the third round, both my tumors were gone. So that was really good news. And I guess, every milestone you want to celebrate and think, that things are going well. Doctor mentioned BRCA test, so I also got my genes tested, especially because my mother had ovarian cancer, but it came out negative. So at least that's also to me a happy sign, because at least I won't pass it on to my daughter, hopefully, right? So I had 6 rounds of chemotherapy. After that, I had a surgery, which is a lumpectomy, to remove the affected areas. And at that time as well, there was nothing that was found, because it was already gone with the chemo. After that, I had 20 rounds of radiation to make sure that it's gone, it's totally gone, and to reduce the chance of recurrence. It was a very, very tough journey, and I would say, finding gratitude in staying positive, finding gratitude in little things. That's what kept me going. That's what helped me. So that was 2023 for me. Pretty much the whole year was spent. I continued to work because I wanted some normalcy in life. I didn't want, everything to be about the sickness. So I continued to work the whole year. And my treatment was from about March till September of 2023. After that, I would say last year, in 2024, life had a different set of challenges. It was like PTSD, right? It was like everything, after the plan was done, there was all the trauma that came. So I had severe insomnia, I had depression, I had very bad cramps, like randomly. I had, of course, a lot of hormonal changes because from the first chemo, I went into a chemo induced menopause. So that causes a lot of havoc in the body because menopause is supposed to, last a few years. And then here it was suddenly one day I was in menopause. So it was quite a tough year. But again, I also tried to counter that. I mean, to me, it was a second chance at life. So I turned to meditation. I did a lot more. I try to be more mindful. I do some yoga. I eat cleaner, like I have less sugar, I have less preservatives, I have more proteins. And I try to reduce stress in day to day life. Easier said than done, but trying. And I've tried to, give back more to community, do things which are more fulfilling, to have a more a balanced kind of day. So that's what helped me kind of to regain strength and focus and give me perspective. And I thought things were going well, but there's a but, right? So when my cancer had happened, it was a doctor had told me it's an aggressive strain. So based on that, he had told me that the first 3 years is a high chance of recurrence. So I was really hoping to clock the third year and then breathe a sigh of relief, but that was not meant to be. So we did regular surveillance scans, PET scan, in fact. And in this year, July, just 3-4 months back, it came back, and it was in the spine this time. It's the same breast cancer, but it was in the spine. And because spine is such a delicate location, we were not even able to biopsy it to confirm the diagnosis, right? So we had to kind of make a hypothesis and move ahead with it. So I was completely devastated because I really believed that the last time I killed it for good, and it's never coming back. I even on my birthday cake I had, like, murdered the cancer, but it came back. So it was, again, acceptance was really, really hard. But again, after acceptance, my doctor, and when it comes back, it is considered stage 4. So previously it was stage 2, and this time when it came back, it's considered stage 4. So it was very rough on me because stage 4, if you know of anyone stage 4, you think that's the end, right? But my doctor was really good and encouraging, and he said that no, mine is only like in one location. It is not spread. So again, it's caught early because of the scanning that we did. It's caught very early. So it's not spread. So it's not technically stage. I mean, it is called stage 4, but it's not. So we will treat it like a early stage itself. So again, in the last 3.5 months, I've had 12 cycles of chemotherapy weekly, and I've just finished my radiation this week. So I'm now hopefully on the road to recovery, and I'm really hoping that I don't want to see the face of it ever again. Please, really, I am done. So it's yes, it is a lot about resilience. It's about life throwing a challenge again, and you having to hit back. So I really don't want to learn that lesson again. But if I were to share a few lessons, and I was told 6 to 8 minutes, I'm trying to keep to that. So if I were to share a few lessons, one is caregivers mindset that we have. Doctor also mentioned. So as women, we play so many roles, we juggle so many roles. We are mothers, daughters, wives, sisters, in-laws, professionals, and we will always prioritize everybody else, right? Take care of everybody, make sure there's food on the table, make sure even at work, the work is tip top and everything. But we often neglect ourselves, and that's absolutely a no-no. I will really request anyone who is listening to please prioritize your health. I used to go for an annual health screening, so mine was caught like kind of in between health screenings, but I prioritized because of my mother's history. I knew it's important, and I used to do an annual health screening. So I would say please make health a priority. And if you feel that something is off, and doctor mentioned a lot of kind of symptoms or things to look out for. If you feel something is off, please don't ignore it. Please get it checked, right? It is a priority. You should treat health screenings like a life jacket, right? Like what they say in the airlines, right? Like you put it on for yourself first before you help others. So make sure you do your screenings, make sure you are in good condition. Only then you will be able to take care of others. So very, very important. Second, again, early detection is key. The earlier you are, detected, the better your prognosis, better your survival rates. And you can save your life, you can save your breast as well, right? You don't have to do a mastectomy if you have an early stage. So monthly breast self exams, the doctor mentioned that from age 20. Mammograms, very critical. After 40, you must follow your country's protocol and do those consistently. or there are other several health screenings as well. I would say, probably you can gift it to yourself like in your birthday month or something, right? So that you don't forget, it is very important. That's the one gift that you should give yourself, right? So please do that. Another one I would say is positive mindset, right? So my doctor had told me, like, I can give you the best of medicine, but if you do not have a positive mindset, nothing, I can't help you, right? So actually healing happens when you believe, right? So I don't know, we're all I mean, I believe in data and science and all of that. I'm an engineer by background, but even doctor, I'm sure, would agree, right? There is, beyond science, there is also manifestation, there's prayers, it does work somehow. So positive mindset is definitely very key. And if I, when I was preparing for this, I was kind of drawing a mind map. So if I were to think of, myself or a patient in the center, and what are the few key pillars that help the patient. So one is, of course, your, very core support network, your family, your friends who are with you through the journey. Another one would be your team of doctors who you must trust, right? You have to know that they are doing the best for you. Another critical one I would like to mention is insurance coverage, because the costs can add up and you don't want to be thinking of financial things when there's so much other stress you're going through. So make sure you have some good plan. And another one that really helped me is a survivor support group, or at least access to survivors, because they are the ones who can understand you. Someone who's been through the journey before can understand you best. So in Singapore we have the Breast Cancer Foundation. It does incredible work in raising awareness and stuff. So definitely I would say all of these are important pillars. And lastly, I would say that cancer does not discriminate. So it's happening earlier and earlier in age. It doesn't matter whether you're rich or poor, whether you are, successful in a career, or you're a housewife, or whether you've been doing all the controllables, right? Whether you've been eating healthy, keeping fit, it can still happen. So screening and awareness are your strongest tools. So yeah, thank you for letting me share my story, and happy to take any questions. Or thank you for that. I thought I would cry today and managed without. So great. Thank you.
Ritika ji, I must say that you are very inspiring. Sharing your own story on the live platform need a lot of courage, and only a brave and beautiful woman can do it. Hats off to you.
Thank you so much. That's very kind of you. Thank you.
Ritika ji, I can literally
All
relate to you
goosebumps.
on
Yeah.
each and every stage of life. Uh, I was not detected early, and I've gone through a lot. But then being with all of you on this platform, and Achla ji and Anar ji being my backbone, my role model, I would say, they've given me a lot of motivation to keep myself going. And today I am here what I am. So thank you, Achla ji, for always being with me and trusting in me.
I must say, Shirin ji, Ritika ji, I can't express what you were saying. When you were saying, I was writing it down. When doctor was advising, I was writing it down. When Ritika ji mentioned, I was writing it down, everything to detail it. But when Ritika ji, you were sharing your story, it's like this goosebumps. I can still feel my heart is like palpitating a lot. So
I didn't
hats
even
off.
go into details because I was given a time. So it's really,
No,
yeah,
ma'am,
it's
I
very
must
hard.
say hats off, really. God is
Thank
so
you.
kind. And I must say that everyone around you are so loving people that they were with you, took care of you. And hats off to doctors, especially who are there with us. So I must say thank you, Dr. Malik, for making us aware. And thank you, Ritika ji, for making us sharing your journey. So at least our eyes should open. Today, I'm learning that yes, I need to go for the screening, and I take a oath that I'll go for the screening.
Wonderful. My days made, at least made a difference to somebody. Great.
Yes,
Well done.
thank
And
you.
it's not one time, you have to do recurring every year. Yes.
No, but I was
Yeah.
scared. I was scared, but I'm taking a oath that definitely within a week I'll go for the screening. Thank you.
Ritika ji, I would like to add something here to what you told. You were talking about meditation and other modalities. Actually, when you look at any cancer, it is not a specific reason, it is multifactorial. So, what we are doing is curing the disease, but what is needed is healing. There are different healing modalities available, and definitely I advocate them to all my patients who are willing to accept. I advocate them the different healing modalities like meditation and so many things are available. Definitely, yes, I am with you on this. We are on the same page. What we need is a healing.
I agree with you, doctor. That's what I'm looking for, a longer term. Yeah. Also, it also helps in stress reduction and things. So yeah. Thank you, doctor.
Thank you so much, Ritika ji. Let's keep moving. Without any further delay, we have one and only our Padmaja ji from Singapore, who has always been with us at all our webinars. I would say I have met you for the last two, three webinars continuously. Your support means a lot to us. Let's hear something more on a brief note about Padmaja ji. She's a merchandiser, now director. Her inspiring journey from training youth in India's jute industry to leading top brands in Singapore. Padmaja ji's journey, a 28-year journey, is one of courage, creativity, and community spirit. Armed with degrees in clothing and textiles and retail management, she rose from a merchandiser to director and the head of marketing for reputed brands, a passionate advocate for women and wellness. Padmaja ji has supported breast cancer awareness for over a decade, earning the Shiro Award in 2022. In 2020, she founded the Shilp store, promoting eco friendly, artisan made products in India. Recognized among top 50 Indian women entrepreneurs by former Singapore President Mr. Halima Yaqub. Padmaja continues to inspire as a change maker, empowering women and communities across border. Without further delay, we welcome Padmaja to the stage. Stage is all yours.
Hi, Shirin. Um, Thank you so much for such a lovely introduction. Although WICCI NRI Council's Anar ji, Achla ji, and you have been strengthening support all through from many years, I always take privilege in attending the awareness sessions by WICCI NRI Council. And Shirin, as she said, I have been highly supported by her introductions, and I'm very happy to always join BKNRI council's sessions. And today being even though it is the last day, but not um, as we say every day, if any awareness camps, sessions, or anything is happening, I think let's not shrug away from taking the responsibility of organizing such shows. And the more we are in connecting ourselves to the world and bringing an awareness to, as today Shafali said, that she wants to take a promise in continuing to self check, because for us, as I said, I have been seeing for over a decade, I have been actively participating in the Penkathon walk in Singapore. I have met Ritika there accidentally last year when this session was happening. This year, I was not able to, but people even asked me, "Are you a survivor or are you doctor to take part?" I don't have to be a doctor. I don't have to be. By thank God, uh, suffering or undergoing any cancer, but I definitely want to bring an awareness by taking actively endorsing myself and reaching out across the world, because I think a global platform like WICCI NRI Council itself is such a wonderful stage to reach out across the world. So as I said, October is not just a month, it's a call for action, a call prioritize our health, our loved ones, and our own well being. Breast cancer awareness is not just about pink ribbons, it is about empowering ourselves and each other around us. Let us come together to bring the stigma to lessen without judgment and to support those fighting the toughest battles. I have been, I have been going with walking in the pink walks, along with other survivors and other people. So during the COVID, when across the world, Singapore is a red dot where we have been inspiring, along with, as Ritika said, Breast Cancer Foundation has been playing a pivotal role in uniting and in bringing women across the world, where we all, as we have been working, we have been coming together for this great cause. So when we walk, I met many amazing women where we used to share the inspiring journey together while walking. Across thousands of men and women, we walk across. So when we were walking and sharing, like when it started, and one of the main management person, when she approached me, I was working in Little India as the head of marketing for a leading store. So when she said, "Ma'am, would you support this women's cause?" I said, "Yes, definitely. As a women endorser, I would love to come." And I took an initiative almost 10 years back to walk in pink saris. So that time we were only just five of us, but from there, a decade back and from now, I think there are, I'm sure Ritika will agree, there are about thousands of women where we are walking for this cause in saris. Walking in saris, this is a 6-yard drape, where we walk in saris for almost 5 to 10 kilometers along with the other inspiring people. So when we walking in saris is not that easy when, it is a tropical country. For 10 kilometers and 5 kilometers, it is definitely, we have made a promise for ourselves to inspire women across the world. When they see, it is an inspiring journey along with many hundreds of women who are walking for this cause. And we are also not just walking, we are we are doing a fundraising session along with that. So maybe, might see, from 5 we have now reached almost hundreds and thousands of women who are coming for a cause to walk with me, along with me. And one inspiring, just a little story I want to share with you all. When I was given opportunity to even represent, and during COVID we were wearing masks, I designed a special pink mask for myself, to receive the Shiro award. Because it is not just me receiving the Shiro, representing thousands of women across. I went up in a mask to receive from one of the minister. She's a leading woman minister. She said, Padmaja, I told, because the theme was formal wear. So I said, "Ma'am, would you want me to come in a formal clothing?" Then she said, "No, no, no, you are a sari queen. Please come in a pink sari." That's how I went in my pink sari. I went and received. That was the moment for me to celebrate with you all, where receiving the Shiro Award, representing this woman. So such kind of stories should be inspiring to many women, not only from Singapore, across the world. Every one of us, let us take a promise to walk in this for this cause in any way. When we are contributing, that itself is, for the community, we are doing such a cause where we can walk. And let us take a promise, like Shaifali ji, Anar ji, Achla ji, or myself, along with Ritika, let us take a promise to reach out to many people. Because I have seen in this journey of almost 10 years, I have seen even single mothers or young women like 20 plus have been affected by this dreaded cancer. So they might need financial support. They might need some kind of, as Ritika said, insurance. So in every way, if we can protect ourselves, it is me as a woman. If I can reach out to these women today, let me take on this last day of Breast Cancer Awareness Month to reach out to the world and every woman, or else not only women, even men can test themselves, go and test, yourself to for an early detection. Reach out to your doctors, reach out to your family doctors or your family, where you can just do simple tests. Like, each test can really be in time saving us from undergoing, there is a trauma, there is stress, not only us suffering, but it is an emotional moment. I'm so sorry, but when I see survivors, they need this is an hour for enlightening to reach out. So it is for families where children might need mothers, children might need fathers, or like this is a month, or let us. I'm so thankful to Anarji for really conducting in time when we all discussed, and I'm really thankful to her, and a big clap to Anarji and WICCI NRI Council and Achla ji for, and Shirin. Shirin has been an inspiring, person to me as well, because she has undergone a lot of, so much of struggle herself. And today, when I see she has been writing books, she has been inspiring, not even leaving a stone behind. She's the first one to moderate such shows, and I'm very thankful that according to the statistics, doctor has said about the statistic, Ritika has said 1 in 4 persons have been suffering, but I understand from the statistics there are about 2.3 million people have been suffering across the world, globe, and there are about 685,000 people have been diagnosed. So isn't that alarming? Yes, that is an alarming. That is making me even though more emotional. So I think in a couple of years back, I also I have gone for this test, and I've been regularly going to check myself. But today, whoever is listening, please take a promise and reach out to many. We have to advocate ourselves, and we have to globally reach out. Along with that, we also have to make a promise. We have to inspire people across in our community, around our environment, to reach out. Maybe you can create a group, self-awareness groups, and also women women awareness groups, where we can inspire, like we can talk about stories of ourselves, and inspire women, create a small groups, reach out and do at least a month. I don't know. Doctor, later you can answer me for this. How regularly can we, go for these tests? That can really be, enlightening, or for us to make ourselves go to see a doctor. So with that, I think as an endorser, as a community leader, I have been doing my part. Along with that, please, I request, not taking much time, let us promise ourselves, and let us maybe energy. I request you to run more of these sessions in future also. Maybe you can run mental awareness session for young children, young adults, or girls, and awareness sessions like this, breast cancer awareness sessions regularly, so that WICCI NRI Council can play a pivotal role in future to to inspire many people across. So with that note, I think as doctor who's a knowledgeable, and doctor who's very skilled, has spoken very well, and with his PPT slides. Yeah, I think Ritika has told about her journey as a survivor, and you won't believe, Ritika, when I asked, when Achla ji has reached out to her, that was the last session of 12th 12th session. So commendable job. Ritika, for coming on board and giving your inspiring journey to sharing your inspiring journey with all of us today. And she must be very tiring. It must be very, very, body. Sometimes this is her second, second time she has been diagnosed like this. So it is not that easy. Yet she has come out to reach out to all of us. So let us do this regularly, and I approach all of you across the world to come and make a promise for yourself. So that is from my side. I'm very thankful again. Thank you, Dr. Mallik, for giving such an inspiring session on breast cancer today. Ritika, Anar ji, Achla ji, and Shirin, Shaifali, you've been amazing. Today, I think you have really taken a promise. Thank you so much. I think I will, that is an inspiring thing for me also. Once in 6 months, I think, or once a year, I must be going for this also. And also, like, there is pap smear test also. I think along with this, let us also go for a pap smear test, so that for the cervical cancer, it will be another good thing for us to self check. Okay, thank you so much, and that's all from my side.
Thank you,
Thank you,
Padmaja ji.
Padmaja ji,
Definitely.
for everything. And thank you for recommending me so highly and motivating me to put myself going ahead. I would actually also want to remember today Dr. Nabad, who was our last speaker for our last webinar. Uh, she unfortunately did not get an early diagnosis. She's fighting breast cancer, and I would say she's still helping mothers to get their newborns come into life. So she's still working day in, day out, and getting the new lives to the world. So I would say let's all pray that she recovers very soon
Yeah, I think from
and
my side, let us pray for her early, speedy recovery.
speedy recovery.
We definitely pray for her, Shirin ji.
Now, without any further delay, let me pass on the stage to Shifali ji, who has been my backbone for helping me in organizing events
I can
and,
say it's vice versa,
helping out
Shirin ji
in doing
always.
everything. So the stage is all yours, Shifali ji.
Thank you, Shirinji. First of all, I must say it's vice versa. I can say my backbone, Shirinji, and my motivator, Ashlaji. Thank you. So I can say that. Although I was not keeping well or some medical emergencies at my home, but thanks to Ashlaji, oh, keep on pushing and you can do it. We are with you. Just one dialogue. You can do it. We are with you. So these two statements really makes a lot of difference in our life. And Padmajaji, I'll tell you, I took an appointment for pap smear and I didn't turn up to doctor. Two times I took an appointment because I was so scared after seeing that doctor was showing that instrument, and I told doctor I'll come next day, and next day I didn't turn up, and two times I did. But yes, it's jokes apart. It's not the matter of joke. It's very serious, and I can understand that being if I'm attending the awareness session, it's not only about awareness, it's about learning. So if doctor is recommending, if Ritika ji is recommending, that means something is there, is deep down serious thing which needs to be identified as soon as possible. And even though if it is not there, it's always peace of mind that we are safe. So down the line, yes, we are safe. One word which supports our family as well. And family is whole family get disturbed if one person is not keeping well. So to
Yeah.
keep them happy, we should be taking care health we should be taking care of our health. And I always believe that I should give gift to my kids always each year on their birthdays, my health, my good health to them, so I can take care of them. So not further delaying, I would like to once again thank you, Dr. Malik. Thank you, Ritika ji, and thank you to Padmaja ji, our esteemed speakers who had actually took out their time, shared their knowledge. One here as a oath already here, so that means a lot. And I would also like to thank on behalf of the organizing team, extending our heartfelt thanks to all who made global voices for women health, uniting against breast cancer and a meaningful success. Really, it means a lot. A sincere gratitude to Dr. Malik, Padmaja ji and Ritika ji, Achla ji and Shirin ji, and all Wiki, not only NRI Council, all Wiki women for their inspiring words always, because they inspire each and every moment. And to our esteemed speakers and the survivors for sharing their courageous stories. Thank you, Ritika ji. Thank you, Shirin ji. And to Doctor as well for sharing his knowledge that what exactly we need to do. A big thank you goes to WICCI NRI Council, Achla ji, also Anar ji, for for getting us on these such platforms, organizing their dedication, and that's why we are standing together for women health and awareness. Let us continue spreading the message of hope, early detection, and unity against breast cancer. Thank you, everyone, and good evening. With not further delay, one vote for me, for myself. I'm myself and taking an oath that yes, we will do early detection, or we will take care of ourselves. So I may request all the women here, 5 women, and Dr. Malik, I may request you also that whomsoever ladies at your house, I know you are a doctor, you take care of them, but still sometimes being taking care of the patients, we forget the women nearby us. So I may request everyone to raise their right hand and take a oath. We as a woman or we as a doctor will take care of ourselves and every women nearby us. We do agree?
We agree.
Can we have can you all unmute and say yes, I do
Yes,
agree?
we agree. Yes, we
Yes, I
agree.
Yes,
do.
we do.
I yes.
Yes,
Yes,
we
I
do.
do.
I think
Thank you.
that's how we inspired today on our platform itself. We have inspired Shafali ji. And from there, I think it will go to hundreds and thousands and across the
Definitely.
globe. We might inspire. We have to inspire. And this is not just the story of today. It will go on until we achieve an awareness and reach out. I think this story goes on and goes on, right?
Ma'am,
I'm
I
sure Doctor
completely
agree with me. Yeah.
yes, completely. So, ma'am, over to Achla, ma'am, and thank you so much. Have a great evening ahead. Over to Achla, ma'am.
Thank you, Shefali ji. Very inspiring session, I must say. First of all, heartfelt thanks to Dr. Malik, our keynote speaker, for enlightening this session. Dr. Malik, you helped us understand the sign, risk, and prevention measure of breast cancer, and most importantly, the power of early detection and awareness. For me, the surprise was, the how our mental state is related to cancer. The tension we create in a daily life is like quite connected to this disease. This is quite an alarming sign for me. You also mentioned that within 1 in the 9 women in India is at risk, including younger women. That is quite surprising because I have seen, like, in the majority of cases, like, elder women goes through these problems, but now even the younger age towards 20s, it's shifting. That's quite alarming sign for me. Healthy living, emotional well-being are a clear call for action. The real life impact and its foundation, your foundation, as you share in the screen, the screening over 2,000 women inspire us all to spread awareness and hope. That's really inspiring. Thank you so much, Dr. Malik, for joining us today. Special note for admiration to Ritika ji, whose courageous journey as a breast cancer survivor inspired hopes and strength. Her determination, grace, and resilience remind us that faith, early detection, and strong support system can help one emerge even stronger. Ritika, your voice today gives courage to countless women, I must say, and this recording will go to many places. You might not see a live fever right now, but when you see this recording later on, it will go to the many people. And then you will learn that you are inspiration for thousands of women. So thank you so much, Ritika, for joining us. And I'm hoping that you will join further also in future sessions as well. Thank you so much, Ritika. One more special thanks to my own sister Padmaja ji. Although she is not a guest for me, she is my own family member, but still, her journey from a merchandiser in India to a director in Singapore and a long standing work in breast cancer awareness, as well as her sustainable venture, the Shilp store, reflect her compassion and commitment to empower others. Padmaja ji, your story inspires every woman, including me, to rise courage and grace. Thank you so much. No
Thank
doubt,
you.
Shirin ji, your gracious host and cancer survivor herself. This show you can only host this show. No one can replace this. So you are the perfect host for
Thank
this show because you know what the actual pain is. So your strength, positivity and warmth have guided us through today's session. I can actually see it. My love and special thanks to Shaifali ji. Although she was not keeping well from last 2 to 3 weeks, still she is supporting at the back end, which I can feel that. So thank you so much, Shaifali ji, for showing your smile today with so much of pain at the back from last 2 weeks, and still she is standing here with us. Thank you so much. My senior Dr. Anar Mehta, our president, not able to join. We acknowledge our visionary leadership empowering women across borders through WICCI NRI Council. Also grateful to Sustainable Future Foundation and Srishti Bharat for their partnership and support to making this meaningful session. Also, we are excited to announce that our upcoming session on 28th November, Friday, on the occasion of International Day for the Elimination of Violence Against Women, the topic of the session is End the Silence, Stop the Violence. So stay tuned. Let us carry forward the insight story and inspiration shared today and truly work together to change her story. Thank you for all. Thank you so much.